This is an instructional video on how to place an emergency UVC. This is a 3x3 step process. The first 3 steps is to find your UVC kit, the UVC catheter, and a 10 cc flush. Because this is being placed under emergency circumstances, you're not going to don sterile gloves, you're just going to do this under a clean environment. This is what your kit looks like. You're going to want to locate your 3-way stopcock. First and foremost, you want to prime your catheter so you're not pushing air through a central line. So you're going to attach your 3-way stopcock to your catheter like so. Any place this arm is facing is turned off. Make sure you clear air out of your flush, and then you can attach it to either port. Again, make sure that your stopcock is turned in the direction where you don't want fluid to flow. And you're going to push until you see fluid come out. Now this catheter is a little bit inside of this sheath here. Go ahead and zoom in. So you're going to see fluid come out of that before you see it come out the end. All right, so this catheter is now flushed. So now I'm going to turn my 3-way stopcock to the catheter, take off this cap, and I'm going to flush this. So there is 0 air, and I'm going to replace that cap. So now my catheter is ready to go. The next 3 steps is to clean, tie, and cut your cord. And you're going to clean from where the cord clamp is down to the abdomen, using all 3 swabs. Having someone to assist you here is going to be helpful to keep the cord elevated for you. Next, you need your cord tie, and you're going to tie this about 1 centimeter above the baby's skin. And this is going to act as your tourniquet, so you want to tie it tight enough that you can slow down the blood flow, but not so tight that you compress the vein that you are ultimately trying to access. The next step is to cut the cord. Now, there's a good chance by this point, if this is necessary, that compressions are happening on your baby, and you might need to ask them to pause for a moment so that you're not trying to cut a moving thing, okay? These are very sharp. Please be very careful that you do not cut yourself. Make sure you're cutting above your cord tie. Now, in a real life situation, this cord is immediately going to start flowing with blood. It's going to completely obstruct your view. So you do have gauze in your kit to help clear your field, and this is when you're going to maybe need to tie that tie a little tighter so that you can stop that. These curved tweezers, if I can get it off, can work well to separate the vessels so you can see what you are looking for. Go ahead and zoom in real close here, like real close. So this particular umbilical cord has 1 artery here, 1 artery there, and then the vein is right here. So I'm going to use these curved tweezers to kind of open up that vessel, okay? And again, this is where having an assistant is going to be super helpful. You're going to take your catheter out of the sheath. Now, if you notice, the measurements on this They don't start until 5 centimeters, and the NRP recommendation is to not advance your catheter past 4. So you're going to have to kind of guess and visualize where that 4 centimeter mark is. Per the NRP instruction, you are to insert your catheter 1 centimeter and then start pulling back on your flush until you get a blood flow, and then the book says to stop advancing. However, the one and only time I have done this, that catheter did not want to stay in place. It kept threading back out. So my recommendation is going to be to advance it to that 4 regardless and no further. Again, this is under emergency circumstances. You're not doing the measurements, so it's not safe to advance beyond that because you don't want to enter the baby's liver. The only exception to that would be if you have a provider here who's giving you instruction otherwise, okay? So visualize your vein. This one's gonna be a little hard. Okay, and then I'm going to start pulling back on my flush and keep advancing until I get a flashback. Now this cord I may not because it's already been out for a little bit, okay? But once I get to the 4 centimeter mark, I'm going to flush 2 to 3 cc's. See how that just slipped out? And then I'm going to hold on to this for dear life because this is your only access to give meds. And you're going to keep holding on to it for dear life until your provider says otherwise. They're ready to place one, a new one, a sterile one, or you are done needing to access UVC to administer medications, okay? The 3-way stopcock is what comes in handy for pushing your ephedrine because, I'm gonna take this out. You can attach your syringe with ephedrine in it, turn your stopcock, push the appropriate amount of ephedrine, block your ephedrine, push your flush, and then just continue holding. And that's how you place a UVC.